Welcome back to another edition of Let's Go Shorts, where we are teaching you how to be more comfortable and competent to care for your patients with obesity. I am Dr. Peter Ammon, a medical bariatrician in Portland, Maine. We are going to do an overview of medications this time, and in the next shorts, we'll give you more specific information on each of these medications. In the previous Let's Go Shorts, we discussed evaluation and testing for patients that are dealing with the disease of obesity. Part of the workup includes a review of current and prior medications patients have used, which may have contributed to weight gain. There's a long list of medications that can affect appetite and weight, including some antidepressants, diabetic medications such as insulin and glipizide, steroids, certain blood pressure medications, and antipsychotics. Some patients being treated with certain antipsychotics can gain significant weight, up to 10 to 20 pounds, even in a few months. Also, generally medications that are sedating, such as antihistamines or sleep medications, can increase appetite. When possible, if weight is a concern, we should think about using alternative medications that are weight neutral or can promote weight loss. Weight loss medications can be considered in the interested patient with a BMI above 27 and comorbid diseases such as hypertension, diabetes, fatty liver disease, or sleep apnea, or in a person with a BMI above 30. Traditionally, a medication could be FDA approved for weight loss if it showed at least a 5% decrease in weight over a 3-month period. A 10 or 15% weight loss is considered excellent. Historically, there have been weight loss medications such as fen-phen, Meridia, or lorcaserin, which have come and gone, taken off the market due to significant or potential side effects. So some providers are nervous about starting these medications, which can be very expensive and have significant side effects. Also, both the prescriber and the patient needs to understand weight gain often recurs when these medications are stopped, and patients still need to work on lifestyle changes to increase their chance of success. This underlies the reality that obesity, like other chronic diseases, needs to be treated often long-term. The good news is, even a 3 to 5% weight loss can promote meaningful improvement in health, lower triglycerides and blood sugars, and decrease the risk for developing diabetes. 5 to 10% or more weight loss can reduce blood pressure, improve LDL and HDL, and decrease the need for medications for diabetes or hypertension. More than a 10% weight loss can improve sleep apnea, fatty liver disease, and reduce heart attacks and improve mortality. I often use the analogy of a gallon of milk, which weighs 8 pounds. If a patient is 250 pounds and a 5% weight loss occurs, this is 12 to 13 pounds. A 10% weight loss is 25 pounds, or the same as taking a backpack off, which contains 3 gallons of milk. That weight loss is significant and noticeable to the patient. Here is a graphic about the goal for impactful weight loss and the greater benefits seen with greater weight loss. You can download this graphic in the description of this video or in Canvas. Cost of weight loss medications can be an issue for many patients. Many insurance companies, including Medicare and Medicaid, do not cover anti-obesity medications at all, which may reflect the stigma and bias against patients with obesity. The Treat and Reduce Obesity Act was first introduced to Congress in 2012 and reintroduced in 2021 to include coverage of FDA-approved anti-obesity medications, which can improve quality of life and be life-saving. Some of the older medications can be created off-label as generic medications, which often are cheaper. The newer GLP-1 injectables can be very effective for weight loss, but often are not covered without a diagnosis of diabetes and can be over $1,000 per month. None of these medications are safe with pregnancy. For dosing, start at a low dose and titrate slowly. Close follow-up is important to assess for side effects, and the goal is at least a 5% weight loss at 12 weeks. If not, consider a higher dose if possible, changing or adding a medication. Let's quickly go through the available medications just as an overview. This will not make you an expert at this time, but hopefully will provide you familiarity for you with these medications to learn more about them. There are currently 9 FDA-approved medications for the treatment of obesity. These include stimulants such as phentermine and diethylpropion, which were FDA-approved decades ago and only initially tested for short-term use. The rest of the medications are approved for longer-term use, which addresses obesity as the chronic disease it is. For the next Let's Go Shorts, we will spend some time on each of them, so you might eventually become comfortable trying them with some of your patients, once you are familiar with their use and side effects.